We are going to talk about graduate programs for addiction counseling. And to talk about this, I have with me Dr. Bradley Connor. And I'm really glad to have him here with us because he did some pretty innovative things with establishing a graduate program for addiction treatment or counseling around addiction. So Bradley, thank you so much for joining me.
Sure, it's good to be here.
Yeah. And, you shared with me about the program that you started up and the innovative things that you've done with that. And so I was wondering if you could just start by sharing with how is it that you chose to get, chose to become a professor and to take on this initiative? And what were the needs that you saw that you wanted to address with graduate programs?
Sure, yeah. So I decided to become a professor or to work as a professor when I was in graduate school, and my research really focuses on the etiology of substance use disorders. So what factors lead into the development of addictions primarily. And I've often spent a lot of my time focused on distal predictors. And so we're thinking about things like genetics and personality traits and early environment. But over time, most of the clinical training I got was in the treatment of individuals who were struggling with substance use disorders or who were struggling with substance use disorders and co-occurring mental health conditions. And what I found is that the field is really separated on how addictions get treated. There are very few licensed professional counselors who specialize in only treating addictions on the psychology side. There is a specialized field for addiction counselors, and that field really grew as a grassroots movement from individuals who are struggling with addictions who couldn't find treatment on their own because they were incarcerated, because they weren't being accepted, because we didn't think about addictions in the early days as a medical disease, but instead we thought of it as criminal behavior. And that's a really important movement. But what it led to was lack of standardization of training across the field. Oftentimes people working in positions because they had lived experience, but they didn't have educational training on how to do counseling, how to ask questions, how to answer questions, how to interact, how to build a therapeutic relationship. And it also led to a lot of individuals who were working in the field but didn't have advanced training because programs didn't exist. And so when I came to Colorado State University in 2012, Colorado State is the land-grant institution for Colorado with the primary goal of training individuals who live in Colorado to be in the workforce. And so land-grant institutions, it's fairly common to identify areas where there are workforce shortages and then educate individuals to be able to address those shortages. And when I started to develop addiction counseling programs in 2012 and 13, there was estimated to be around 30 counselors for every 1,000 individuals who are struggling with substance use disorders, which is a fairly low number. It was, and the turnover in the field is really high, burnout is really high. And so there are a lot of individuals who struggle with addictions who can't find treatment. So much so that it's estimated that less than a quarter of the people that meet diagnostic criteria for a substance use disorder will ever get any treatment at all. And if you think about
that's remarkable, a quarter, 25%, that's extremely low. Because the statistics around, mental health in general treatment, it's much, much better than that.
Oh yeah. Yeah. I was gonna say, if you think about, we often try to compare addictions to chronic illness models because they act as chronic illnesses. They don't go away. And so you think about the treatment rates for diabetes or high blood pressure or schizophrenia or major depression, they're much higher than that. They're usually, greater than 60% of the population will get treatment of some sort. And so we started to develop the program, and the first program was an undergrad concentration. So trying to address another problem, which is that individuals who graduate with bachelor's degrees in psychology often find it difficult to work with that degree. There aren't a lot of bachelor's level employment opportunities for individuals with a bachelor's in psychology. So we created an undergraduate concentration that led to being qualified as a level 1 addiction counselor and having a bachelor's degree in psychology. That was our first program. And then we developed a 2-year master's program that was really designed to address a number of problems. The need for advanced training in addiction counseling, the need to increase diversity among graduate students in graduate training in the United States, especially in Colorado, and the need to provide sophisticated graduate level training for people who are going to do counseling work. So those were the goals that we set out with. To develop the Master's in Addiction Counseling and Psychology program. It's a 2-year program, 1 year on campus taking classes and 1 year in a full-time internship. And we did things to make it accessible for everybody. So we don't require GRE scores. We don't require letters of rec from previous faculty members. We only require 2 letters of recommendation. And we focus primarily our admissions criteria on the statement of purpose because we want to recruit individuals who have a strong desire to treat individuals who are struggling with addictions. And so the primary admission evaluation is on the statement of purpose. And then we plan the classes so that they are only 2 days per week. They're on consecutive days. We understand that people in the program are going to have to work in full-time jobs, and we don't want it to be too much of an impediment. And what that's resulted in is 100% retention rate, 100% graduation rate, and greater than 90% of the graduates working in the field, and having somewhere between 70 and 80% underrepresented students in each incoming cohort, whether that's students of color or students with expansive gender or sexual orientation identities, or returning students who've been away from school for a very long time, or first-generation graduate students or first-generation college students. That's the students that we're educating in the program.
Yeah, so hopefully everyone heard that, because that's amazing. I mean, the barriers that you've taken down, 1 year in the classroom kind of setting, right? The second year is you're in an internship. I mean, that's a huge shift. That's incredible. Yeah. And then the retention rate and graduation rate, that's absolutely amazing. So, I mean, all these barriers that have just been taken away, incredible. And getting the job done, right? Graduating people that are competent and ready to do the job and hireable. So is your program accredited by like an accreditation type agency? And if so, how did that work out with such a drastic shift?
Yeah, so the program is currently accredited by the Higher Learning Commission, which is the same commission that accredits any programs across almost all universities, especially state universities. So it has the accreditation similar to any other program on any other college campus. And we're working towards getting NASAC accreditation, which is the National Association of Addiction Counselors. It's their accrediting body to be recognized as an accredited education program for addiction counseling. We're still a fairly young program. We've just admitted our 5th incoming class. And so we're working towards that accreditation, and hopefully we'll have it soon. The interesting piece is I do a lot of talking. I do a lot of explaining to people about why we operate the way we operate. I've had to interact with individuals at all levels in the university and with accrediting bodies so they understand why we try to keep the number of units that we require low to reduce cost for the program. The same thing with the 1 year on campus, the 1 year internship, even the internships. If individuals are already working in the field, we don't ask them to leave their job. We just turn their job into the internship. So right. A lot of conversation is the best answer to the question you asked me. That was just being present in meetings and talking a lot.
Right. Yeah. And I could see how the results are going to be great too, because you hear about all these people that get into programs and that's all they do, right? They just go to school, nothing else. And then they graduate and they're like, do I really want to do this? and then they end up never even working in the field. And, yeah. But you're getting people in the field that, they're more seasoned and not necessarily the traditional or student body. And yeah, so the results are there. That's absolutely amazing. Yeah. And then I know, also in terms of positioning these students really well, I think you told me before that you also are creating kind of a dual program with social work. Is that right?
Yeah, so that's on the horizon to launch in the fall of 2021. Would be a master's in addiction counseling and a master's in social work. That would be a 3-year program with 2 years on campus, 1 year in the social work courses, 1 year in the addiction counseling courses, and then a 1 year internship. And upon graduation, students would have an MSW and a master's in addiction counseling, and they'd be eligible to be licensed as both a licensed clinical social worker and a licensed addiction counselor. So that's another way we've been trying to help providing specialized training to it for individuals who are interested in that training.
Yeah, that's very attractive. I mean, that really positions them for all different types of job positions in the
Yep.
future. And then on campus, you guys provide counseling services,
Mhm.
and use like everyone else, you pivoted to provide those services virtually. Can you tell us a little bit about that and how that's gone?
Sure. So we have a training clinic where we train both the PhD counseling students who are going to hopefully go on to be licensed psychologists and the addiction counseling students who we expect will go on to be licensed addiction counselors.
Mm.
And prior to the COVID pandemic, we we did very little telehealth. The vast majority of the services we provided were to the local community in Fort Collins and around Fort Collins. And then, the pandemic hit and everything shut down, and all of the mental health models shifted to telehealth pretty rapidly. And we were able to write a grant to the Substance Abuse and Mental Health Services Administration to access some of the CARES Fund, which is the first big funding package to address the pandemic, to expand our services to be telehealth around the state of Colorado for individuals above the age of 25 who were struggling with issues related to suicidality or substance use, or who had been victims of domestic violence, using telehealth to provide free mental health services for the duration of the grant period, and to also provide access to social workers to get housing security, food security, getting access to Medicaid. And the most interesting part of that is that the announcement for the grant came out on a Thursday, and the grant was due the following Friday, and it was funded within 2 months, which is a timeline that doesn't exist in the grant world at all.
Wow.
So,
The government was ready to give the funds, and you had to get ready to receive it.
yeah.
Yeah.
And so the biggest shift was, I think one of the hardest things, the biggest shift for us is in the training model that we use in the on campus clinics. Most of the sessions would get recorded, and then as supervisors, we would watch the students' tapes or the video and provide feedback. And so in addition to switching to this telehealth model, we had to solve the problem of how do we create those same recordings in a telehealth world, and how do we get different softwares to talk to each other, and how do we store the videos and then upload the videos to a centralized server wherever we have access to them. All things you never think about when you're in a face-to-face environment.
Yeah. That's what us consultants are for.
Right.
That's what we spend hours trying to figure out. Yeah. And can you talk a little bit about the research you're doing with marijuana, right? Cannabis use and drug testing for that.
Yeah. So the other thing that I did when I came to Colorado State University in 2012 was rapidly set up a research lab. In 2012, Colorado was among the first states to pass laws that made cannabis use recreationally legal. So for individuals over the age of 21, they could purchase marijuana products or grow cannabis in their house and use it legally. And then there was a 2-year window while we developed regulations and implemented the regulations, where we were able to track what cannabis use patterns look like. So we have this rich data set of pre to post. How did cannabis use shift in the state of Colorado? And then what are the new things that we need to worry about now that we have a drug that's previously was illegal, is now legal? And so I got really focused in on trying to understand how individuals define a dose of cannabis, because it's not really well defined. Prior to recreational legalization, there had been multiple states that had developed medical legalization for cannabis. But if you think about this, there's not really a schedule for how you would use cannabis to treat disorders. We know that there's good research that suggests that cannabis can treat certain things. It can treat pain, it can treat nausea, it can treat conditions. But there are very few drugs that are approved for those kinds of treatments where we don't know how much and at what potency and at what frequency an individual should take the substance. And so in the cannabis world, it would be like going to a doctor and the doctor saying, you have this condition. I'm going to recommend that you take this drug. I don't know how much of it you should take. I don't know how often you should take it. And I don't know how you should take it, but I know it'll help.
That is bizarre. That is bizarre. Even with vitamin C and those kind of things, they'll give you dosing.
Correct.
Right?
And so really been trying to focus in on how do we define a dose of cannabis, and how do we understand what appropriate doses are? How do we use cannabis as medicine? How do we even make recommendations around what appropriate recreational use looks like? And so we've been collecting data in a number of different ways to do that. Another thing is even to think about how do we track how much cannabis an individual uses. With alcohol, it's a bit easier. We can ask you how many drinks you had. If an individual is drinking beer, they may know the exact alcohol content of what they've been consuming. With cannabis, if we say, how much did you use? An individual will say, I smoked a joint or I packed a bowl, and I don't know what that quantity is. And so we've done research. We've had individuals do things like that, roll joints or pack bowls, and then ask them to estimate how much cannabis they think is in there. We weigh it, and we can figure out that people are actually pretty bad at estimating how much they use. And so trying to find ways to improve how we estimate cannabis use so that we can get a better handle on what would be appropriate use for recreational purposes, what would be indicated use for medicinal purposes, and what would really indicate problematic use that might lead to the development of a substance use disorder, cannabis use disorder. And that's another big debate in the field. For a long time, people didn't think that cannabis was addictive, but it turns out that about 1 in 10 people will develop dependency on cannabis when they use it. And so trying to make recommendations, like I said, can be really helpful for people to understand how to not become dependent on a substance, how to use it in a recreational way appropriately, or how to use it to appropriately treat the conditions that they're struggling with.
That's the first time I heard that 1 in 2 people that use cannabis will become dependent upon it.
1 in 10, but yeah.
1 in 10. Okay, 1 in 10. Yeah. All right.
It's still a pretty high number, not as high as 1 in 2, but 1 in 10. Right. And there are a lot of variables that can change that prediction. So, the younger an individual is when they start using. So individuals under the age of 15 who are using at a high rate, a high frequency, so daily, are going to increase the likelihood. The potency that people use. One of the things that happens when a state legalizes cannabis for recreational use is products become more potent pretty rapidly, because agriculturally you can do a lot more things legally. And so in Colorado, it's not uncommon to buy concentrated cannabis products that are 90% or higher THC, which is
amazing.
Unheard of number.
Holy moly.
And we have no idea what the impact on the individual is going to be when they're using that. Because most of the research that's done on cannabis is done with flower cannabis that's about 20%, or I'm sorry, that's about 8% THC. So you're talking about an 80% increase.
Moly.
In availability. So it's just a different world. And so there's a lot of research to be done in this area.
Yeah, most certainly. And I know I'm going back a little bit, but my mind's stuck on it with the services that you provide, the counseling services that you provide through the university, and expanding. I call it expanding to telehealth, transitioning to telehealth. But I say expanding because I'm thinking the need that you have in your area with the population that you're working with people that might be rural area, long distances, maybe difficulty with transportation and so forth. Did you get like a huge influx? Like, are you getting more and more and more people wanting services, or no?
We did, and I think you made a couple points that I want to reiterate, which is, when people think about Colorado, I think they often think about sort of Denver, Boulder area. They think about municipalities, but there are a lot of really rural areas, and they're not just mountainous areas. The entire eastern part of the state is prairie or agricultural areas where there are often no resources for mental health services, no hospitals, no nothing, and so we did get an influx from those areas. We also hired a number of Spanish-speaking therapists and counselors because we knew that a large portion of that population was Spanish-speaking. And I think that's probably where we had the biggest impact. Is we saw an increase in the patients we were serving and the clients that we were serving, but we saw a dramatic increase in the number of individuals who only spoke Spanish, who were living in rural areas, who had never had access to care before, who we were able to provide care, who are still providing care for to this day. And with it came installation of infrastructure in places where there normally wouldn't be. So if you think of what would it take to open a clinic in a rural area, you have to buy a building, maybe, or rent a building, get some land, blah, blah. Here, what we need to do is make sure we just provide space for people to have a confidential environment where they can have a conversation, even using a phone. With the video features of a new smartphone, they can get into the telehealth world. And so I think it's an important expansion, and I do call it an expansion as well, because I don't know that, assuming that we get back to the way the world was prior to the pandemic, I don't think that telehealth market's going to go away. So I don't think we'll retreat from that expansion. I think we'll go back to more face-to-face services in the city, but we'll continue to provide care in rural communities via the telehealth model because of that. So I think it's been an important expansion.
Yeah, and especially with your graduate program on addiction treatment, I wonder if you'll become like a real hub for the state or several counties for that kind of treatment.
I hope so.
Yeah,
Yeah.
so you're prepared to expand.
Yeah.
Yeah. Now, just before we end, do you have anything you'd like to say to those that are considering getting into a graduate program for addictions treatment? They might have some hesitancies, some fears, and so forth.
Yeah, I mean, I think that if you look at the numbers and you look at the way that the world is shifting, the Affordable Care Act has been for many people a really good thing. For the field of addiction counseling, it's been a bit of a struggle because what comes with the Affordable Care Act is mandates that insurance will reimburse, but only for providers who have a master's degree. And so it's really difficult if you're working with a degree less than a master's to bill Medicaid or to bill other insurance. And so looking for programs like ours that provide the opportunity to get an advanced degree, and as you said, removing a lot of the barriers that typically exist to getting into graduate school, mean that people will be well positioned to bill insurance as insurance continues to expand. And so if an individual has a strong desire to work with people who are struggling with addictions, then getting a master's degree means they can open their own practice, they can bill insurance, they can provide a higher level of care to individuals who really need that care. And they're going to step into an area where there's so much need that they'll be turning jobs down. Like that there are multiple employment opportunities that exist across the United States. And so in my mind, it's almost silly not to get the education. Obviously, I'm biased. I run a program, but in my mind, the way the world is shifting, the way that the healthcare world is shifting, not having a master's degree is going to be a detriment soon for addiction counselors.
Yeah. And do you have an online graduate program? Like if someone's not local?
We don't currently have an online program. In a stepwise process, it's on the horizon for us. But the first was getting the program up and running, and then the expansion for the social work profession. So we're on our route, but slowly but surely we'll expand it to online.
Yeah. Well, thank you so much for the work that you do and for this interview and all the information that you shared. I really appreciate it.
Thanks. Yeah.